Okay.
Hi.
We can start.
We can start.
Sound is okay?
1, 2,
Yeah.
1, 2.
All right. Good. Then I will start by now. So, ladies and gentlemen, welcome to our podcast. I'm your host, Emre Hayroğlu from Medipol University in Istanbul. And today we have a special guest joining us, Professor Nikolaus Plesnila, an esteemed researcher in the field of cerebral microvessels and neurovascular disorders. Together we will explore the fascinating world of stroke research, biosensor technologies and chemogenetic tools. But before we dive in, let's extend a warm welcome to Nick and congratulate our consortium, consisting the both of us and Professor Pierre Gressens from France, on winning the prestigious AirNet Neuron Call grant. We have met in Istanbul for our first kickoff meeting, and our consortium of 3 principal investigators is dedicated to advancing research in stroke and its molecular mechanisms. I'm really honored to discuss some insights and expertise on the fascinating intersection of brain, microvessels, stroke, the development of novel technological tools and therapeutic strategies. So Nick, welcome again, and we have recently secured an AirNet Neuron Call grant. As someone who may not be familiar with the intricacies of stroke research, could you please explain in simple terms what happens in the brain during a stroke and what are the primary factors that contribute to the occurrence of a stroke?
Yeah, first of all, before answering your question, thank you very much for having me here today with you and your fantastic team. I had a fantastic time, to get to learn all your team members, and I'm really impressed about their work ethics and also about the ideas and how you discuss progress in your team. So coming back to your question, stroke. So let's think maybe as a stroke in terms of a definition. Yeah. So the word stroke means in English, you're basically struck. So you fell to the floor like struck by a lightning. Yeah. And this is also exemplified by the other word for stroke, which is apoplexia or apoplex, which means you fall to the floor suddenly. Mm-hmm. This may resemble somehow the symptoms you have when you faint, because when you faint, your blood pressure goes down and you lose consciousness because your brain is built in such a way that it doesn't have any energy stores, right? So when blood flow stops, for example, from one of your limbs, it can stop for an hour without causing any damage. However, because your brain doesn't have any stores like your muscles, when blood flow stops going to the brain because, for example, your heart stops, then you lose consciousness immediately. However, in terms of blood pressure, usually the blood pressure comes back, so you wake up, a minute later because you're lying on the floor, your blood pressure recovers. In terms of stroke, it means that something more severe happened because the symptoms of fainting and losing functions of some of your body parts persists. Mm-hmm. Yeah, so you may have a short attack, which is called TIA, transient ischemic attack, which results only in short symptoms of stroke. But then you may have a real stroke, which means that these symptoms persist for hours, for days, sometimes if you're unlucky for the rest of your life. Mm-hmm. So by definition, it is a cerebrovascular disease, yeah, and the stroke is kind of the symptoms describing this disease. And the reasons for having these diseases are, first of all, one type of stroke is called global cerebral ischemia, meaning that your whole brain doesn't receive enough blood. For example, when your heart stops, when you have a cardiac arrest. Yeah. So then also, if the cardiac arrest is longer than 3 to 5 minutes, then you may have also hypoxia to your brain or ischemia to your brain and get global damage to the brain. And this results, for example, in loss of memory function, mainly. So people who suffer this have that. Then the other type of stroke, for example, is that not enough blood reaches your brain, meaning that you have, for example, based on cardiac dysfunction, that you have little clots which form in the heart and then they go up into your brain and occlude an artery. Or you may have atherosclerosis and parts from your brain perfusing vessels, the large vessels, they lose a piece, it goes into the brain and causes obstruction of a vessel. So There is no blood flow in a certain area of your brain, and this causes this area of the brain, first of all, to stop working. So you may have, for example, weakness of a limb, or like an arm or a leg, or funny sensations in your fingers or so on. And there is a third type of stroke which results in the same kind of symptoms, but are usually associated with very, very strong headache. Yeah? And this is usually a hemorrhagic stroke, meaning that a vessel in your brain basically bursts. And this results also in blood being present in your skull. And too much of this blood being in your skull is also causing some damage. So these are you have global cerebral ischemia from cardiac arrest. You have stroke due to a so-called embolus, so a piece of something which travels to your brain and occludes an artery. Atherosclerosis may be also a reason. And the other one is hemorrhagic stroke. And most strokes, so 85% of all strokes, are of the origin of that, what I said in the middle. So basically it's called ischemic stroke, so lack of blood flow to the brain. And this ischemic stroke, 85% of patients are affected by this, and 15% of patients are affected by hemorrhagic stroke. So this is this is kind of what stroke is, and how the definition is.
Right. Let's talk a bit about stroke recovery, which is extremely critical and a critical aspect for patient care. Are there any exciting developments in the field that focuses on enhancing stroke rehabilitation and helping patients regain their abilities back? Or how can technologies play a role in this process?
That's a very, very good question, because essentially modern medicine is very, very good in treating acute diseases like stroke, like myocardial infarction, and so on. So nowadays we are in the area of minimal invasive medicine, where radiologists or neuroradiologists can take a little catheter, put it in one of your vessels at the leg, go to your heart or go to your brain, and reopen these arteries. So this is nowadays possible, supplemented by some drugs which help these clots to dissolve. So that's what we do nowadays, but we are not very good in helping patients long term. The reason is, in terms of stroke, is twofold. One reason could be that we don't know what's actually going on, how to help these patients. The second could be not everybody knows. And the third step is we know, but we cannot put it in place. And in stroke rehabilitation, we have the two-letter issues. We have a lot of research done in the 1990s, for example, on humans and on monkeys and on other experimental models, where we know how the brain regenerates after a stroke and what needs to be done. And I can tell you a small anecdote. There was a postdoc working in a laboratory in the States where they worked on these stroke rehabilitation techniques. And he knew that you have to practice your paretic arm as much as possible. His dad got a stroke in Mexico. So the day his dad got a stroke, he flew back to Mexico and started to train his father, who was paralyzed on half of his body. He couldn't even stand, because half of the body was basically paretic, so was paralyzed. So he started to train with his dad for 1.5 years every day for about 8 hours. And after 1.5 years, his dad was completely restored. He could go back to work, and he was completely fine. He died 10 years later, and after he died, his son agreed in an autopsy. They took out the brain, and one half of the brain was gone due to stroke. But all the function was essentially moved to other parts of the brain due to this very, very intensive training. So we know that this is what should happen. However, not everybody has a son who works in stroke research, and not everybody has a son who has the ability to stop working for 1.5 hours and comes to you and trains you for 1.5 years because he has the respective knowledge. So, and here the other problem comes. This research was half forgotten. There are nice books you can buy and read, but even in the stroke field, most people are not familiar with this research performed in the 1990s. And the third point is our health system cannot provide this kind of help. it's just,
Too expensive.
you cannot train somebody 8 hours a day. So in Germany, we have rehab centers. In the States, there was a research center or rehab center built on these principles, but it bankrupted after 15 years, and it doesn't exist anymore. Because what needs to be done is so incredibly expensive that we cannot implement it in our rehab strategy we have. So it's a little bit frustrating.
Is there an alternative?
Well, so research now goes into the direction that we try to find out which factors are released and which mechanisms are activated by this intensive training in order to be able, let's say, to develop a pill which does the same as this training. I'm not so sure if this is going to be possible. Maybe another possibility could be, instead of understanding the molecular mechanisms and providing, let's say, a drug which is doing the job, maybe, since we are in the area of artificial intelligence and robotics, that, who knows, maybe in a couple of years we will have a robot who's taking over the role of the sun, and is going to work out with patients, a couple of hours per day, then you have a robot sitting next to your bed saying every morning, now wake up, come and let's go and do this and this exercise and so on. Who knows? So this could be a potential way where future technology may help us,
Which brings me actually to the next question, because as far as I understand from that, what you're saying is, at the moment we are trying to find a pill that people can take as a treatment, however, which does not exist. There are no such treatments at the moment, as far as I know, that can help treating stroke. And you already started discussing in this direction. If you look ahead in the next 10, 20 years, taking into account all this artificial intelligence, what kind of breakthroughs or do you envision for stroke research? And do you think are there any emerging technologies, methodologies, especially artificial intelligence, robotics, etc.? Would you believe that they would have a profound impact on diagnosis, treatment, prevention in the future for stroke research? Especially what you already started discussing in the direction of robotics and artificial intelligence?
Yeah, so this referred more to the topic we discussed before in terms of rehabilitation. But stroke research is a much, much, much broader field. So we can divide it in certain, let's say, sectors. We can say like stroke prevention is one area where people work, because with the area, let's say, of genetic investigations, we started to understand which genes are responsible for an increased risk for stroke. To cut a very, very long story short, there is not a single gene or 2 genes or 5 genes who are responsible for an increased risk for stroke, because stroke has many reasons, as we discussed in the beginning. It can be bleeding, it can be ischemia, it can be heart disease. But we know which genes are kind of increasing the risk. And if we're looking into these genes and what they do, they are mainly associated with arrhythmia of the heart. The heart is not beating, with a certain rhythm, but it's kind of arrhythmic, and with atherosclerosis, and also with overweight, with smoking, and also with lack of physical activity. So where research is done right now is to avoid these risk factors. So to tell people, don't smoke, move more, work out, and try to keep your body weight. And on the other diseases I just mentioned, arrhythmia and atherosclerosis, there is intense research in this area to understand and how to prevent this. High blood pressure is another risk factor. So by just normalizing blood pressure, and this is a worldwide attempt in the last 20 years or so, to give everybody who has a slightly increased blood pressure medication. Actually, the stroke incidence decreased over the last 20 years, while, this blood pressure treatment kind of got distributed, in the whole population. And now people are intensively working on preventing atherosclerosis and also heart arrhythmia. So this is for prevention. Now, we were talking also about stroke research. So what we used to do in the last 30 years, where we were not able to develop any kind of good therapy on the molecular level, was that our tools were very limited. So now we are entering, for a couple of years already now, an area where genetic tools enter stroke research. Very specific, very specific genetic tools like the ones we're using in our consortium, together with imaging technology. So now we can actually look into the brain with, for example, magnetic resonance imaging. This is kind of, when you have your brain scan, this is basically what you do. So now we have brain scans for experimental animals, very small ones. We can do some radioactive guided imaging where we understand like molecular imaging of the brain. And we have microscopy techniques to really look into the brain and see what's going on. Yeah? And before, we were just able to label some cells, so if you look with a microscope in the brain, you don't see anything. But if you label cells, you start to see the cells, where they go and what they do. And now we are entering a novel area where we start to understand what actually happens within these cells. Yeah? Because now we have genetic tools, artificial genetic tools, where we can design sensors which tell us what's going on in the brain, in the living brain, and we can investigate this with very sophisticated microscopy techniques on the level of single cells, parts of the brain, single vessels, cells which line the vessel inside and which are sit on top of the vessel. So I think these are very exciting new techniques which were not available like 5 years ago, even 3 years ago. And now we're entering this new exciting area. And we talked already about what needs to be done in rehabilitation.
Right.
So these are the three fields where I think technology will help us.
So if you look at the big picture, actually the limitation was the lack of such tools.
Exactly.
To visualize some mechanistic pathways in the cells,
right,
down in subcellular locales, to understand what's going on there, so we could mimic them and treat them. So and at the moment we are, especially in our consortium, are exactly there, where we have developed tools where we can do both, visualize and mimic some cellular mechanisms, and to better understand how they work, so we can develop develop tools for that. That was actually my question, but you answered it already. But this is fine. So let me ask you a last question for our audience. Our interdisciplinary collaboration play a vital role, of course, in this scientific progress. And part of our consortium, how do you see the synergy between your expertise in several microvessels, my expertise in biosensor technologies, the expertise of Professor Gressens, who is primarily on single-cell transcriptomic analysis, and all of our contributions? How do you think that, especially in this AirNet consortium, will our expertise shape the future of stroke research? And do you think that this will have potentially revolutionize stroke management in the near future, or will we be able to see that revolution in the next years, decades?
That's very complicated to say. Specifically, revolutions are kind of events which happen like an eruption, out of a moment in milliseconds, or a few hours, few days. I'm not so sure. I would say research is more of a constant, very tedious, constant work on a very small question, or maybe a larger question you try to answer, and usually it takes very long time to answer it. But I agree with you with the term revolution, since now we have scientific tools available, I just described before, and you mentioned them as well, which allow us to investigate cerebral vessels and the cells composing cerebral vessels in a detail and with a spatial and temporal resolution which was not available before. So basically we can look over time what happens, and we can look very precisely what happens with cells and within cells, and also manipulate these processes. And maybe this came across already during our discussion. It's a very complex enterprise we try to achieve. So, and for this, because things are terribly complicated nowadays, I mean, techniques get better, but only a microscope to visualize a vessel in the brain of an experimental animal is so complex that not a single researcher is really able now to use all of these techniques to investigate the whole story. And that's why I believe that this is a problem generally in science, that everybody investigates what he can or she can investigate with a specific tool. So we have very narrow questions with very narrow answers. And I think this is one of the big advantages of our consortium. We have your group here in Istanbul, which is one of the leading groups worldwide in developing these tools, to manipulate, for example, the pathway of reactive oxygen species. Yeah? So we can induce reactive oxygen species, we can measure them, we can see what happens in stroke, we can induce additional reactive oxygen species, in a stroke model or in a healthy brain and see what's going on. But this seeing is kind of our job. You look at it in cultured cells, which is a very important step. We can look if this happens also in stroke. And Pierre Grassin in Paris, he's a super specialist in taking out cells out of the brain or from a dish and see what happens on the protein level and what happens on the genetic level. Yeah? So what do these cells express? And bringing together these three areas of expertise allows us now to basically cover the all methodologies which we need to address the very specific question of our consortium, which is what is the role of reactive oxygen species, a certain damaging product of cell metabolism, let's say under normal conditions, but which is highly emphasized or upregulated during pathological conditions, in stroke. And this couldn't be answered 3 years ago, 2 years ago, last week. Mm-hmm. Now we have all the tools together, and by the three of us being able to team up, and also by this fantastic tool of ERONet Neuron, which allows researchers in Europe, and here I see Turkey as part of Europe, of course, to work together and to solve this question. Yeah? And this will give us, I think, very interesting results over the next few years.
So exciting. This is really so exciting, and I'm so proud to be part of this really great consortium. I thank you very much again for being my guest here in Istanbul and for our kickoff meeting. I look forward to make groundbreaking research with you and some breakthroughs, hopefully in the future, and contribute to stroke science in the future. Thank you very much for coming, Nick.
Yeah, thank you very much, Emrah, for the invitation and also for this very nice discussion. And I'm also looking forward, to collaboration with you and, of course, also with Pierre in Paris. So great things will come. The future is bright.
Thank you very much.
Thanks.